Hello, dear students. Myself, Dr. Junaid Amin. I welcome all of you to the second part of the video, which is urinary tract infection. So, let's start today's topic by investigations. The first thing you have to remember is urine dipstick test. In urine dipstick test, it indicates the presence of nitrites in the urine, which indirectly indicates the presence of bacteria in urine and thereby helps us to diagnose whether the patient is having UTI or not. The second thing which urine dipstick test indicates is that leukocytes. Actually, the leukocytes are normally present in the urine, but their significant increase in number indicates UTI. Now, it also indicates the presence of RBCs in urine and thereby letting us know that there is hematuria or not, which indirectly helps us to diagnose UTI. Now, the thing which I want all of you to remember is that if both nitrites and leukocytes are present in a urine, it indicates UTI. If nitrates or leukocytes plus RBCs are present in the urine, it indicates UTI. If only nitrites are present in the urine sample, it also indicates UTI, and therefore these three conditions needs to be treated as UTI. If only leukocytes are present, it's not treated as a UTI. It's not treated as a UTI unless indicated. Therefore, nitrates are a specific indicator for determining whether the patient is having UTI or not. The second investigation which we can do is that we can send midstream urine sample to the lab. The midstream urine sample, when sent, it is sent for microscopy, culture and sensitivity. And what it does is it helps us to indicate two things. What are those two things? First thing is it helps us to determine what is the causative organism for causing UTI. Infective organism, or you can call it bacteria. And second thing, it helps us to determine the choice of antibiotic. We don't send midstream urine sample in all patients, but it is particularly needed in pregnant patients, recurrent UTI. Those who are having recurrent UTI, we can do microscopic culture and sensitivity, and those who are having atypical symptoms. And the last one, whose symptoms not improve by antibiotics. Now, coming to the causative organisms. So, the first organism which is responsible for causing UTI is E. coli. E. coli, and others include Klebsiella pneumoniae. Second one is Enterococcus species. The third one is Pseudomonas, and the fourth one is Staphylococcus saprophyticus. Staphylococcus saprophyticus. You need to remember these things. The first organism is E. coli, second is Klebsiella pneumoniae, Enterococcus species, Pseudomonas, Staphylococcus saprophyticus. Now, coming to the treatment part. The treatment part, the choice of treatment is antibiotic. And the initial antibiotic which we use is trimethoprim and nitrofurantoin. Trimethoprim and nitrofurantoin. But this trimethoprim is often associated with increased bacterial resistance, and the nitrofurantoin is avoided in renal impairment patients. What are the alternative antibiotics which we use? The alternate antibiotics include cefixime, amoxicillin, and cefazolin. Remember this: cefixime, amoxicillin, and cefazolin. And the second thing is which you need to remember is that tell the patient to take plenty of oral fluids. Now, coming to the last segment of the topic, which is UTI in pregnancy, which needs to be treated as a separate entity. The UTI in pregnancy is associated with increased risk of pyelonephritis, premature rupture of membranes, and preterm labor. That means if there is UTI in pregnancy, they are mostly supposed to get pyelonephritis, PROM, or preterm labor can occur in such patients. Sir, how we will treat these patients? What is the management for this? The management for UTI in pregnancy is it needs 7 days of antibiotics. But we need to choose these antibiotics in a very appropriate manner, as these are associated with certain risk factors, side effects you can say. The first antibiotic is nitrofurantoin. But this nitrofurantoin drug is associated with it's avoided in third trimester of the pregnancy, as it is associated with what? It is associated with risk of neonatal hemolysis. Remember this thing, this is very important. Risk of neonatal hemolysis is increased. And the second drug which is used in pregnancy is amoxicillin. But this amoxicillin drug is used only after sensitivity. The third drug which is used in is cefazolin. So remember these three drugs, that is nitrofurantoin, amoxicillin and cefazolin. If you are using trimethoprim, it needs to be avoided in first trimester of the pregnancy, as it is associated with something called as congenital malformation. Remember this thing, congenital malformation. Because this trimethoprim acts as folate antagonist. You might be knowing that's why we use folic acid supplements in pregnancy to prevent congenital malformation. But this trimethoprim drug it's generally avoided in pregnancy. It's generally avoided, not used. So this was all about urinary tract infection. I hope you liked the video. If you are having any doubts, feel free to comment down below. Do subscribe my channel. Thank you. Take care. Goodbye.